Imagine living life on an emotional roller coaster. One moment, you're on top of the world, and the next, you're plunged into the depths of despair. This is the reality for many living with borderline personality disorder. In this video, we'll explore what BPD is, its symptoms, causes, and treatments, and how we can support those affected by it. Stay tuned, you won't want to miss this. Welcome back to our channel. If you're new here, don't forget to subscribe and hit that notification bell so you never miss an update. Today, we're diving into a topic that's both complex and deeply misunderstood: borderline personality disorder, or BPD. What is BPD? Borderline personality disorder is a mental health condition characterized by intense emotions, unstable relationships, and impulsive behaviors. It's estimated that about 1.6% of adults in the United States have BPD, though the actual number could be higher due to underdiagnosis. This disorder often manifests in early adulthood and can impact many areas of a person's life, including their self-image, emotions, behaviors, and relationships. According to the DSM-5, to be diagnosed with BPD, an individual must meet at least 5 of the following criteria: fear of abandonment, unstable relationships, unstable, self-image, impulsive behaviors, self-harm or suicidal behavior, intense mood swings, chronic feelings of emptiness, inappropriate, intense anger, paranoid thoughts, or severe dissociation under stress. Symptoms of BPD: intense and unstable emotions. People with BPD often experience emotions more intensely and for longer periods than others. They might go from feeling extremely happy to feeling extremely sad within a short period, often without a clear reason. This emotional instability can make daily life very challenging. These rapid and severe mood swings are not just occasional, but are regular patterns that can interfere with their overall functioning. Impulsive behaviors. These mood swings can lead to impulsive actions, such as spending sprees, unsafe sex, substance abuse, reckless driving, or binge eating. These behaviors can provide short-term relief, but often lead to long-term problems. The impulsivity is often in areas that could be self-damaging and can make life unpredictable and dangerous. Fear of abandonment. A significant symptom of BPD is an intense fear of abandonment, whether real or imagined. This fear can lead to frantic efforts to avoid real or perceived separation or rejection. This might include impulsive actions to keep people close, or intense reactions to even minor separations or changes in plans. Unstable relationships. People with BPD often have intense and unstable relationships. They may idolize someone one moment and then suddenly believe that the person doesn't care enough or is cruel. These swings from extreme closeness and love, idealization, to extreme dislike or anger, devaluation, can strain relationships. Unstable self-image. Individuals with BPD often struggle with their sense of self. They may have sudden changes in self-identity and self-image, including shifting goals and values. They may see themselves as bad or as if they do not exist at all. This unstable self-image can lead to sudden changes in interests and values. Self-harm and suicidal behavior. Self-harm and suicidal behavior are serious symptoms of BPD. Individuals may engage in self-harming behaviors such as cutting or burning themselves. Suicidal threats and attempts are also common. These behaviors are often a way to cope with emotional pain or to express a need for help. Chronic feelings of emptiness. People with BPD often report chronic feelings of emptiness. They may feel bored, unfulfilled, or like there is a void inside them. This feeling can be persistent and overwhelming, contributing to other symptoms like impulsivity and unstable relationships. Intense anger. Inappropriate. Intense anger or difficulty controlling anger is another symptom. Individuals may often feel very angry, have frequent angry outbursts, or engage in physical fights. This intense anger is often disproportionate to the situation at hand. Paranoia and dissociation. Under stress, individuals with BPD may experience paranoid thoughts or severe dissociation. Dissociation can feel like being cut off from oneself or like the world is unreal. These experiences can be distressing and can interfere with daily functioning. Causes and risk factors. Genetic factors. Researchers believe that BPD results from a combination of genetic, environmental, and social factors. Studies have shown that individuals with a family history of BPD or other mental health disorders may be more susceptible. While genetics alone cannot cause BPD, they can increase the risk when combined with environmental factors. Environmental factors. Childhood trauma. such as abuse or neglect, is often linked to the development of BPD. Many people with BPD have experienced significant traumas during their childhood. These traumatic experiences can include physical, emotional, or sexual abuse, as well as loss, neglect, or separation from caregivers. Brain structure and function studies suggest that abnormalities in brain structure and function, particularly in areas that control emotions and impulses, may also play a role. For instance, the amygdala, which is involved in emotional regulation, tends to be more reactive in those with BPD. Additionally, the prefrontal cortex, which helps with impulse control and decision-making, may be underactive. Social factors. Social factors, including an unstable or chaotic family life, can contribute to the development of BPD. Lack of a stable support system, ongoing stress, and the presence of other mental health disorders can also increase the risk. Relationships with caregivers and peers during formative years can significantly impact emotional development and behavior patterns. Diagnosing BPD can be tricky because its symptoms often overlap with other mental health disorders, such as bipolar disorder, depression, and anxiety. A comprehensive psychiatric evaluation, including a detailed personal and family history, is essential for an accurate diagnosis. The diagnostic process typically involves clinical interview. A mental health professional will conduct a thorough interview asking about symptoms, medical history, and family history. Psychological evaluation. This may include questionnaires and structured interviews designed to assess specific symptoms and behaviors associated with BPD. Review of medical history. A detailed review of medical and psychiatric history helps rule out other potential causes of symptoms. Input from family or close friends. When appropriate, gathering information from close family members or friends can provide additional context and insight into the individual's behaviors and symptoms. Treatment options. Psychotherapy. While BPD can be challenging to treat, there are several effective options available. The cornerstone of treatment is psychotherapy. Dialectical behavior therapy, DBT, is one of the most effective forms. DBT focuses on teaching skills to manage emotions, improve relationships, and reduce self-destructive behaviors. It combines individual therapy with group skills training sessions. DBT emphasizes mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Other therapeutic approaches, such as cognitive behavioral therapy, CBT, and schema-focused therapy, can also be beneficial. CBT helps individuals identify and change negative thought patterns and behaviors. Schema-focused therapy helps identify and change deep-seated patterns or themes, schemas, that can influence behavior and thinking. Medication. In some cases, medication may be prescribed to help manage symptoms. Antidepressants, mood stabilizers, and antipsychotic medications can be used to treat co-occurring conditions like depression, anxiety, or mood swings. While medication does not treat BPD itself, it can help alleviate specific symptoms, making it easier for individuals to engage in therapy and manage daily life. Hospitalization. In severe cases, short-term hospitalization may be necessary, especially if there is a risk of self-harm or suicidal behavior. Hospitalization can provide a safe environment and intensive treatment to stabilize acute symptoms. Long-term residential treatment programs may also be an option for those who need ongoing intensive support. Living with BPD self-care practices. Living with BPD requires ongoing effort and support. Self-care practices such as mindfulness, regular exercise, and healthy eating can make a significant difference. Mindfulness helps individuals stay present and manage intense emotions. Regular exercise can improve mood and reduce stress. Healthy eating supports overall well-being and can help stabilize mood. Building a strong support network of friends, family, and mental health professionals is also crucial. Support groups can provide a safe space for sharing experiences and gaining insights from others who understand what it's like to live with BPD. Connecting with the others can reduce feelings of isolation and offer valuable coping strategies. Coping strategies. Developing effective coping strategies is essential for managing BPD symptoms. This includes identifying triggers, practicing relaxation techniques, and engaging in activities that bring joy and fulfillment. Learning to set realistic goals and celebrate small achievements can also help build a sense of accomplishment and self-worth. Ongoing therapy. Continued therapy is often necessary to maintain progress and manage symptoms. Regular sessions with a therapist can provide ongoing support and guidance. Therapy can help individuals navigate life's challenges, build resilience, and develop healthier patterns of thinking and behavior. How to support someone with BPD. Educate yourself. If you have a loved one with BPD, your support can make a world of difference. Start by educating yourself about BPD. Understanding the symptoms, challenges, and treatment options can help you provide informed and compassionate support. Practice empathy and patience. People with BPD often struggle with intense emotions and fear of abandonment. Practice empathy and patience, recognizing that their behaviors are symptoms of their condition, not personal attacks. Listening without judgment and validating their feelings can help them feel understood and supported. Set healthy boundaries. Setting healthy boundaries is crucial for both you and your loved one. Boundaries help ensure that your relationship remains healthy and that you can provide support without becoming overwhelmed or enabling negative behaviors. Communicate your boundaries clearly and consistently, and encourage your loved one to respect them. Encourage treatment and self-care. Encourage your loved one to seek professional treatment and engage in self-care practices. Support them in attending therapy sessions, taking prescribed medications, and practicing healthy habits. Remind them of the importance of these steps in managing their symptoms and improving their quality of life. Avoid judgment and criticism. Avoid judgment and criticism, as these can exacerbate feelings of worthlessness and rejection. Instead, offer positive reinforcement and acknowledge their efforts and progress. Celebrate small victories and provide reassurance during setbacks, and seek support for yourself. Supporting someone with BPD can be emotionally taxing. It's important to seek support for yourself as well. Consider joining a support group for families and friends of individuals with BPD, or seek therapy to help you cope with the emotional challenges. Taking care of your own mental health enables you to be a more effective and supportive presence for your loved one. Borderline personality disorder is a complex and often misunderstood condition, but with the right treatment and support, individuals with BPD can lead fulfilling lives. It's essential to remember that progress can be slow, and setbacks are a normal part of the journey. However, with perseverance, understanding, and support, those with BPD can develop healthier ways of thinking and relating to others. If you or someone you know is struggling with BPD, reach out to a mental health professional for help. There are numerous resources available, including hotlines, support groups, and therapy options tailored to the needs of individuals with BPD. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. And don't forget to subscribe to our channel for more insightful content. See you next time.